Children's Miracle Network has announced the 2013 CMN family. The Pluta family of Salinas has a remarkable story to tell about the birth of their twins. It's a story that will warm your heart.
But approximately 2 weeks of age, our transport team went to UCSF. We actually brought both babies together in the same isolette, which is an acceptable mode of transportation when babies are stable. And they were able to continue their care here at Salinas Valley Memorial Hospital.
So happy. I was so happy to see the transport team come in. I remember Rose and Jan, the transport nurses. They were wonderful. They walked in, they knew what they were doing, they introduced themselves, they assessed the babies, they had a game plan, they were ready. It was great. We were coming home, even though it wasn't home underneath the same roof, but we were home in the same town.
The female, Faith, she had been the bigger of the babies. She continued to gain weight very well and stayed for approximately 10 days following the transport. Grant, who had the issues with being smaller and also with the heart issue, had to stay for approximately 4 weeks.
On July 5th, Jeff had called down the hall and told me Grant had gotten sick. So I ran down the hall to go check on him, and he was blue. He wasn't breathing. His eyes had rolled back in the back of his head, and he wasn't moving. I started CPR and told Jeff to call 911. Within just a few minutes, Grant started taking a couple agonal breaths. We could hear the sirens coming. Paramedics, fire, the whole 9 yards. Everybody was in the house, and he was transported back to Salinas Valley. I immediately called the NICU, and I started talking to one of the nurses, telling him what had happened. They put me on the phone immediately with Dr. Castro.
Him knowing Grant and been, overseeing Grant for the past month, he knew all of the ins and outs of him. So they were down there when we got there in the ambulance, which was very comforting.
Grant unfortunately had to be readmitted to our hospital after some respiratory issues, which probably was related to what we call gastroesophageal reflux, or with issues with his milk that he was drinking coming up the esophagus and causing what we term as apnea, or sometimes a failure to breathe.
They figured that he had severe reflux and a high gastric pH, so his stomach acids were very high. So anytime that he refluxed or got sick, it caused a spasming of his airway that clamped it down and put us into a scare each time it happened.
It was at that point where we, as a group, along with their pediatrician, decided that they require some specialized testing, which was done, and I understand now they've done so well. It was subsequent that I found out that the father of this baby was, again, one of the primary individuals that was able to initiate the purchase of this ambulance. And then, ironically, his twins were the first sets of babies that we actually transported here to our hospital. And it was incredible that that happened, but it was not obviously by design.
I'd like to thank, from the doctors helping the process from the very beginning, the day they were transported the first time, down to SVMH till the last time Grant was there. It was fantastic, and it was a great experience for us. It was comforting and they did a fantastic job.
I don't feel that if it wasn't for Salinas Valley that the babies wouldn't have come home when they did. A huge thanks for everything that they did, and the staff and the doctors. I just can't thank them enough.